Good afternoon, everyone. My name is Eddie Wiggins, and today I want to talk to you about addiction and its connection to physiological psychology, and subsequently, how this should affect how we view those battling addiction. Addiction has been a human struggle for centuries, and it affects millions of people worldwide. It's a complex problem, and while we've made some strides in our understanding of it, there's still much more to learn. To start, let's look at addiction from a physiological perspective. This means we're going to look at the underlying biological processes and mechanisms that cause it. With a deeper understanding of the biological processes that contribute to addiction, we can develop empathy and compassion and more effectively treat and intervene with addiction. There are several specific areas of the brain that have been implicated in addiction, including the prefrontal cortex, the amygdala, the ventral tegmental area, or VTA, located in the midbrain, and the nucleus accumbens, or NAC, located in the basal ganglia, just to name a few. These brain regions are involved in decision-making, reward processing, and habit formation. So how are these brain regions involved? Well, addiction is best explained by changes in the brain's reward pathway. The brain's reward pathway is a complex system of those brain areas mentioned that reinforces behaviors that are essential for survival, such as eating, drinking, and sexual activity. The main components of this reward pathway are the VTA, NAC, and prefrontal cortex. The VTA produces dopamine and sends projections to the NAC, which is involved in processing reward-related information. The prefrontal cortex aids in decision-making and helps to regulate the activity of the reward pathway. So what happens is dopamine is released in response to a pleasurable experience. The release signals to the brain that the behavior responsible for that pleasurable experience should be repeated in the future because it is associated with a positive outcome or reward. So in addition to eating, drinking, and sexual activity, when a person takes a drug, the drug affects the release and reuptake of dopamine in this reward pathway. With repeated drug use, the brain's reward pathway becomes altered and is less sensitive to the natural rewards, such as food or sex. The changes in dopamine release can then lead to an increased desire for drugs or other behaviors that cause a dopamine release, like gambling, which can then lead to addiction. While we've made significant strides in our understanding of addiction, there's still much more research that needs to be done. Research has shown that interventions such as cognitive behavioral therapy can be effective in treating addiction. However, there are ethical considerations and limitations to the research that we need to keep in mind. For example, individuals who are neurodivergent or anyone with neurological development and functioning that differs from what is considered typical or normal may be more vulnerable to addiction. Individuals with attention deficit hyperactivity disorder may have altered dopamine pathways in the brain, leading to a higher risk of substance abuse. Or individuals with depression or anxiety may use drugs or alcohol as a form of self-medication to alleviate symptoms, which can lead to addiction. It is important to provide targeted interventions and support to these individuals to prevent and treat addiction. Historically, addiction was often seen as a moral failing, and the individuals who struggled with it were stigmatized and ostracized. Today, we've seen physiologically where addiction comes from in the brain. Addiction is a complex interplay between the brain, the environment, and genetics. In fact, addiction is now recognized as a disease by the medical community, and it's something that needs to be addressed through a multidisciplinary approach, much like any other injury or illness. If you have a broken arm or are injured, you go see a doctor. If you have a cold or some illness, you go see a doctor. Likewise, if your mind is injured or ill, you go see a doctor. Thankfully, the stigma around mental illness, and particularly addiction, is changing. We do not think poorly of someone with a broken arm or a cold, and in the same way we should not think poorly of someone battling addiction either. They are ill, they are suffering from a disease, and need the help of a professional. Thank you for listening.